right, take it away, Mary Jo. There you are in the center.
Thank you so very much. I appreciate everyone inviting me to give a quick update. For Family Consumer Sciences and Career Tech Education, I can honestly say that there are no major changes coming down the pike that I know of or am aware of, which is the first time in a little while. So teachers, you can breathe a little bit of a sigh of relief. Today was the last day to do a CTE 26 application. I am sure all of you have all of those applications in. Your superintendents have signed them and everything's good. We have about 750 applications for me to approve here in the next couple of months. So that's a great start. Not all of our programs in Ohio were due this year. So FYI, you may be on next year's schedule as well. So we've got that. We have the personal finance, financial management CTAG that is available. A quick update on that. They've stopped the letter of affirmation. All you have to do is have an approved career tech program, and the CTAG is automatically available for your program. So that's 3 steps that we don't have to do anymore, and that's fantastic. About next year, spring of next year, we will be starting the review of the standards courses and end of course tests. So watch those newsletters. I'll be asking for panels of experts to be helping out with that endeavor as soon as they open that up. FCCLA is going through regional career development event competition as we speak. It's all online. It's been an interesting time. We have about 700 competitors. They have done an online test. They've had a video and a PDF document that they've uploaded. As I'm watching the scores, it looks like everybody's done a fantastic job. For those of you who have volunteered to be evaluators, we do appreciate that. Anyone that would love to help out and be an evaluator for state, which will be in about 5 weeks. Drop me an email. We'll be glad to utilize you. We'll get a whole new set of evaluators. The top 2 from the state will go on to nationals. That competition, I was just on a conference call with them, will be mid-May. And so we will be moving right along. So that would also be online. So this year, students do not have to redo their projects from in person to an online. They've been online all the way through. So that will help. Education and training, early childhood education, hospitality and tourism, culinary arts, they're all moving along just fine. We're currently working on a CTAG for baking and pastry. We hope to do a pilot, field test it this spring, possibly next fall, depending on how things work out. End of course tests are due for everyone. They're not off the books, they're on the books, just like we have always done in years past. They're due the end of May. Watch the newsletter for last dates and updates from WebZam on that. I think that covers all of the things that I have for this year. It's been a very slow year, and I think we can all enjoy that fact that it's been a very slow year on many things. So thank you for having me. If you have questions, please put them in the chat room and I'll watch.
All righty.
So
Marie?
thank you. So thank you for having me. I'm Marie Economist. I'm the Family and Consumer Science Extension Educator for Ohio State University Extension. And what we would like to share what we're doing here across the state. Many of us Family and Consumer Science Extension educators, as we all know, that we bring that body of knowledge, research-based information across our state of Ohio. And as extension educators, we're building those lives, we're better building those lives and strengthening those communities no matter where we're at, and meeting those families' needs. We look at the 3 healthies: healthy people, healthy finances, and healthy relationships. And as we look at those areas within our body of knowledge and the research and the needs within our state of Ohio, we look at those for for the people within our state and meeting them where they're at. So when we look at healthy people, we're looking at the one area is for food safety preparation. Might it be for our restaurant industry? Many need ServSafe, level 1, level 2 for testing. Many of us across the state are doing that instruction. This past year, we weren't able to do it as much in person, but we did have the opportunity to offer it to them online. But that continued need is doing that ServSafe, doing the food safety preparation for restaurants, for community, where it might be with somewhere within the community need that education. We're definitely offering those opportunities for our communities across the state. So that certification, being ServSafe instructors, is one thing for our family consumer science extension educators. That's smart food planning. Might it be anywhere from the young child through the lifespan, as we bring that body of knowledge across the lifespan and helping build that. Might it be our Dining with Diabetes series to our Living Healthy, Live Well series of opportunities from our lunch and learns that we offer to our communities. And this year we're doing all these things virtual and bringing it to the platform that all of our people within our state so much need, in helping meet that and helping improve that physical health across that lifespan with all people. We also have the preserving food safely, that food preservation more than ever for this year, that food preservation, bringing it from the field to the table and then putting it within our pantries. Food safety, our food preservations were offered, those programs were offered online, virtually, and so many people definitely tuned into those opportunities. So our family consumer science extension educators who have that knowledge have brought it to our communities virtually this year in many different ways. So our farm to school, our local foods, we heard about the pantry and trying to get those foods to from the pantries in Athens, but across the state, and helping work with our communities with local foods, the OSU Extension Farm to School from the early years, but also within the schools, working with our food service and meeting those needs of our food service, from our managers to those staffs, helping them gain the knowledge within their communities. That's ongoing for them to need that professional development that they so much need. Within working with those healthy people, we try to meet all those needs of bringing those healthy aspects to our families and across the board. Healthy relationships is our other area we very much also embrace and looking and building. So the mental health, with this year, especially with COVID, but it's always been there, in helping relieve that stress management, as we have our mindful wellness team who has brought together the opportunities of bringing mindful wellness series from the young to our older groups, to bringing it virtually at this time for our families and for our adults. With our mental health, we also have our first aid mental health FCS educators who are trained to bring those opportunities within our communities also. We know within healthy relationships, we also have the early childhood education. Early childhood education right now is definitely building that workforce and bringing that professional development for our early childhood professionals. The Power of the Profession is a big movement of growing that workforce of our early childhood professionals. Many family consumer science extension educators are doing that work, bringing that professional development to our state of Ohio, to our workers, to those professionals that so much need it. Also within relationships, we have the parenting parenting education, along with successful co-parenting, which is another program that definitely helps with parents who are going through divorce and trying to meet those needs. Within healthy relationships, our FCS educators also are always looking at that healthy workforce. No better time than right now is thinking about that workforce, where they're at, no matter what industry they're in, and helping develop and help them meet them where they're at in developing different opportunities for them to bring that professional development as we build on that healthy relationship. The other key area, finance. We can't leave without finance, talking that for a moment. Healthy finances within our teams with family consumer science educators here in the state of Ohio. We start from the early years with, we know how important those finances are from, we have Smart Start for our early childhood educators to learn and help grow our early childhood, our preschoolers to learn about money, but also moving across into our middle school, Real Money, Real World, and helping them learn through a series of understanding about money, to our adults, learners, to understanding about budgeting. No better time than now, that understanding about how their money is, how to save money, and giving those opportunities. We have within family consumer sciences are also many certified, the housing, urban, the HUD development approved counseling agency, who are trained to do, as you see here, buying homes and saving for homes. So our family consumer science educators, many of them are certified to help many of our families within our communities who want to have a home someday and be able to purchase that with those opportunities. So with that special counselor as being one of our family consumer science educators, those are very much needed within our communities today. So as we look at all those different areas within our healthies and bringing that body of knowledge within the state of Ohio, you can see here as we embrace all those areas of building those healthy families across the lifespan in healthy relationships, healthy people, healthy finances, and meeting where they're at. And as we said, that body of knowledge and research so much is very much needed, always, and will be. Thank you.
Thank you, Marie. And next we have Liza. And Liza is going to tell us about WIC. There you go.
Okay,
There you go.
so we're good to go?
Good.
Okay, so my name is Liza Ickes. I'm a dietitian with the Cuyahoga County WIC program. I'm the nutrition manager. I have worked for this program for 33 years, so I definitely believe in this program. So I'll just take you through some slides as far as what WIC is and what we're doing now with the changes with COVID. WIC has been around for 47 years. It is 100% federally funded. The grants go through the Ohio Department of Health here, and then they go down to the local projects. Metro Health holds our grant. Many other places it's held by the health department. So we are employees of Metro Health. Ohio employs registered and licensed dietitians, diet techs, 4-year nutritionists that work under the dietitian. We have an international board certified lactation counselor. We have certified lactation counselors. We have peer helpers that are WIC moms that have breastfeeding experience that provide support and education to our moms. We have WIC administrative staff, WIC support staff, and all of us are trained in the basics of WIC breastfeeding management. What is WIC? It is a special supplemental nutrition program. It does provide a combination of nutrition education, breastfeeding promotion and support, nutritious foods, Medical and social service referrals. We screen and refer for immunizations. We provide voter registration. We also provide education and information on safe sleep and participate in the Cribs for Kids program. And in Ohio, we have several counties that are working with a quality improvement project to provide education to moms about the urgent maternal warning signs so that we can have an impact on maternal mortality and morbidity. It is a program for women, infants, and children up to the age of 5 who meet the income guidelines and are at risk for developing any nutrition-related health problems. So nutrition education is our emphasis. It does encompass breastfeeding and healthy behaviors and family-based change. We do provide nutrition participant-centered counseling at least twice in a 6-month period, and we hope that this knowledge that they take home helps to keep their families healthy for years to come after they've even left us. Our nutrition messages are that babies are meant to be breastfed. You know, how can we help you eat more fruits and vegetables, lower your saturated fat, increase your whole grains, eat less sugars, increase your activity, and reduce your screen time. With our breastfeeding promotion, all our prenatal participants are educated about the benefits of breastfeeding, how to correctly position and latch their babies, hand expression, and all the breastfeeding participants are given support and encouragement as long as they desire to breastfeed their babies. Ickes definitely had a proven track record. We are a short-term program as far as 0 to 5 if they choose to stay that long, plus why mom was on, but it definitely has some long-term health effects. Moms do have longer pregnancies, which obviously would mean then less premature babies and infant deaths and healthier babies. We do save healthcare dollars with our better outcomes in our pregnancy, getting more moms to breastfeed and having other health outcomes that are positive. We have improved nutrition and health behaviors. We have an increase in key nutrient consumption. For our infants and our children, they are healthier. They have better growth and development. We generally screen for iron when we're not in COVID, so we definitely have an effect on their anemia levels, immunization rates. More of them will see the doctor, and we can hook them up with social service programs, and they have better diets. And 50% of the babies that are born in the US are WIC babies. And when kids that are on WIC go to school and start school, they're better ready and they have better cognitive performance. I'm going to talk a little bit about the food package that we provide to them. It does address the major health and nutrition risks, being obesity and overweight, short breastfeeding durations, and trying to get their diets healthier with more whole grains and fruits and vegetables. The food packages do align with the dietary guidelines and with the American Academy of Pediatrics infant feeding guidelines. As far as some of the foods that we provide, it is the milk and the yogurt, eggs, cereal, juice, peanut butter, dried beans, or canned of their choice, fruits and vegetables, whole grains, and some participants will qualify for the soy milk, the tofu, and the cheese. As far as what and how they can get these things, the vegetables and fruits are a cash amount, so they can pick and choose what they want. If they happen to go over, they could pay the difference. So we do encourage them to really get up there and try to use all of that is there for them. It can be fresh, frozen, or canned. As far as the whole grains, it's not just bread. It can include buns, tortilla, brown rice, oatmeal, and pasta. And then we have a separate list for cereals, and half of those also have to be whole grain choices. Like I said, we follow the guidelines of the American Academy of Pediatrics. So we do recommend breastfeeding for the first 6 months, and then when they introduce complementary foods, to continue that breastfeeding for at least a year or as long as mom and baby desire. The formula amounts are adjusted. It'll depend on what the feeding practice is. Are they breastfeeding exclusively, partially, not breastfeeding? So from 0 to 6 months, the formula amounts may vary. Complementary foods, the baby cereal and fruits and vegetables are not given until the babies are 6 months. WIC stopped giving juice a long time ago. It can reduce their appetite for foods and may reduce their formula and breast milk intake. So we don't provide juice anymore. And like I said, they'll get the fruits and vegetables and cereal. And if they're exclusively breastfed, they may get the baby meats. As far as what we provide for our breastfeeding moms, if they're fully breastfeeding, they get the largest package with the biggest variety. So they may get even more of the foods that you saw listed. And then they may also get cheese, and then they get canned fish, which would be tuna or salmon. And then for their baby, if they're still exclusively breastfeeding, once the baby's 6 months and up, they'll get the meats added to their package. And then through that whole first year, our breastfeeding peer helpers are reaching out to these moms and connecting with them at least monthly, and more if they need it, to provide them with that support and help them with any problems or questions that they're having. The WIC foods are supplemental, and they're all on a electronic style benefits card, like an EBT card. We call ours the WIC nutrition card. And this is a card that we use in Ohio. We also have some tools that we have for our participants to help them connect with us. One of them is the WIC Shopper app. So on this app, they download it to their phone. They're able to check balances, so they don't have to keep receipts and everything every time they go to the store, because when they use the card, they can get a little bit at a time. They don't have to get it all. They can also get recipes, find out where WIC stores are, where WIC clinics are. They can report problems they're having at the store. The food list is on there, and they can scan foods in the store to find out if they're WIC approved foods for them. We also use social media. We are aware that it's pretty popular and it allows people to interact rather quickly. We use Facebook and Twitter to connect to our participants. We use our Facebook page to list where our farmers markets are going to be, get information about our clinics if they're open or closed, and to promote anything that may be happening in their clinic. We also have a texting program that we use to remind them to come in and to load benefits to their card. It's time for them to have that done. And if something was to happen at a clinic that might affect its normal operation, we would also reach out to them that way to let them know. Ohio WIC has also developed a map so they can go online, put in where they're looking for that location. If they find something that's convenient for them, they can click on it. It'll actually bring up a map showing them where on the map that it is, give them the address, the phone number, and what the location is called. As far as participants signing up for WIC, all they need to do is call and we'll get them signed up. Pretty much the only thing that we would need outside as far as medically would be a proof of pregnancy, but everything else we can pretty much take care of. We are doing our enrollments a little different due to a federal waiver, which right now is still in effect until mid-May, and it could get adjusted again. We'll find out in April. When a participant calls a WIC clinic, we pretty much are trying to complete the whole visit over the phone, and that would include the nutrition counseling. So we'll do all the visit. We don't make them bring the children into the clinic. And then we do ask that a healthy adult comes with any of the documents that we may be able to not have been able to see, because they could also email documents if they chose to. They'll bring the documents in. And in Ohio, because we are an offline system, they do have to present to the clinic to get their WIC nutrition card loaded with benefits. And then they will get loaded, and generally it's anywhere from 1 to 3 months, and then they don't have to contact or be back in the clinic for that time period until their next load. And even with these waivers and the things that have gone on for COVID, we are very grateful that we have been able to continue service without interruption and continue benefits without interruption to our participants. And that's pretty much all I have. If you have questions, you can put them into chat, and I just thank you for this time to talk to you about WIC.
Thank you, Liza. That was, boy, you got a lot packed in that period of time. So we have heard about settings in K-12, and we heard about the community-based with extension going from birth till down the line. And then we've heard about the WIC program. So now we're going to hear from Deborah Wooldridge, followed by Lisa Diebel, and they're going to be talking about higher education. So we're going to start with Bowling Green.
Good afternoon. Thank you for asking me to be part of the program. What I thought I'd do is just kind of hopefully give you some positive news. I know that everybody's always asking about FCS Ed teachers, and okay, looked like it was frozen there for a moment. We started the program back around 6 years ago. And I think this year we'll probably graduate our largest class. There should be about 5 or so graduates coming out. Other graduates in the past have been placed and they seem to be thriving. So that's positive. Right now it's under workforce development where they do business ed or FCS ed. And I do believe they're looking at changing the nomenclatures to CTE, but I'm not part of that development team. But all of our programs are real interdisciplinary. You'll find them in the College of Education Human Development or the College of Health and Human Services. And the FCS Ed program is a joint program by the School of Teaching and Learning and the School of Family and Consumer Sciences. So we have a collaboration there. Overall, the programs related to family and consumer sciences are thriving. We probably have over 600 majors and about 200 minors. All of the programs are accredited nationally. The Fashion Merchandising Consumer and Product Development Program will be going through accreditation in the spring. Some updates there. Of course, our students can apply to go to FIT in New York and do 1 year of study there, or they can stay on campus. We also have a minor in fashion merchandising product development, and fashion merchandising product development has a new name. It was apparel merchandising, and we just got the approval for the fashion merchandising. We moved into our new facilities about 5 years ago, maybe going on 6, upgraded some labs 2 years ago, and we just created a new product development lab where they can do more construction. And hopefully the FCS students, ed students will be taking part of some of those classes too. Probably our largest major is Human Development and Family Studies with about 240 majors and several minors. The newest minor is a Child Life Specialist minor where they can get all the courses except for the practicum, and we're working with a Child Life Specialist in Columbus to hopefully provide we can provide a graduate practicum for them so that they could move on and get their Child Life Specialist and then work in hospitals. So that's kind of the newest thing in human development. Family studies, many of the FCS majors, if they decide they really don't want to teach, they transition into human development family studies because they decide they want to do some nonprofit work. We have study abroad too, and I'll talk about that. And then we have interdesign, and those students do get to participate in Chicago trips, and some of them do study abroad. There's about 100 design majors. And the FCS Ed students do take six to 9 hours in design and 6 to 9 hours in fashion merchandising. And the rest of their courses sort of come out of the human development, family studies, and food and nutrition areas. And then the fourth area is dietetics. There's about 90 majors in dietetics and 10 in food science. And that program is found in the College of Health and Human Services. We do a lot of collaboration with them, and students do get their Safe Serve certificate through them and their F&N courses. And then, as I said, we do study abroad. This will be our We've done Italy, study abroad in Italy, 11 years. One faculty members just created an Iceland study abroad, but because of COVID, we had to put that on hold. And one of the interior design new faculty is creating a study abroad in Germany. So there's lots of opportunities. We're trying to infuse diversity, inclusion, and international concepts into all of the curriculum. There are student groups for each of the students to be involved in. There is an honor group, and we do have several named scholarships in family consumer science that students can apply for. All of the students within the programs do either a work practicum or an internship, or they're encouraged to do a co-op. So they do get some experience out in the field. And let's see. I think overall, we keep upgrading our facilities. This probably April, I'll start upgrading all the technology. And I think we're excited too about the product development construction component that we're moving back into the program. So we hope that helps in the FCS Ed or any of the other areas that may want that to be part of their education. So that's what I have. Thank you.
Thank you, Deborah. Great to hear the update. And then we have Lisa Diebel, and she is the coordinator and instructor of the FCS program in the Department of Human and Consumer Sciences, and this one is at Ohio University.
Thanks, Margaret. Good afternoon, everyone. I'm Lisa Diebel. Thanks for having me. I am the program coordinator for the FCS Teacher Education and Community Leadership Programs. Currently, Ohio University is the only university in Ohio that has an accredited program through AA FCS, and we are really proud of this. Since I took this position 5 years ago, the programs have continued to grow and strengthen each year. Teacher Ed is at 100% placement currently. With the amount of interest that I'm seeing this spring, I'm really expecting to see even more growth this coming fall, and I'm very excited about that. And Mary Jo, this includes male as well as female students. In our HCS department, we have a retail fashion and merchandising program that had a name change recently. There's also hotel, restaurant, and tourism, customer service, and my two programs in our current department. Next year, we will have a new online program available as well. And next year, our HCS program will be merging with another department, and we're really excited about that. We're excited to see where that will take us. I was delighted this December when many of my FCS community leaders graduated and really got good jobs in the middle of a pandemic. One student started a job as an assistant teacher at Nationwide Hospital Daycare Center. Other places include an autistic rehab tech, manager at Kindred Market in Athens, and a data specialist for the YWCA. These are jobs that they are very excited about with good wages and full benefits. And again, in the middle of a pandemic, I was just thrilled to see them each getting jobs. So I really believe this is a great time for FCS. Thanks again.
Thank you, Lisa. I appreciate the update from OU.